Peripheral signs of aortic regurgitation. It is a very important topic, but many students find them difficult to remember. In this video, we'll break it down step by step and understand these signs from head to toe. This is a big list of findings which are associated with wide pulse pressure. Wide pulse pressure is there is an increase in systolic BP and decrease in diastolic BP. Difference between the systolic and diastolic BP is called as wide pulse pressure. Wide pulse pressure is the main cause for for all these peripheral signs in aortic regurgitation. Just try to remember all these names because in final year MBBS case presentation, these names are very, very important, right? Now let us start from the head. D Muset sign. D Muset sign is nothing but rhythmic nodding of head with each heartbeat. And moving to the eyes, there are two signs in the eyes: Landolfis and Becker's sign. Landolfis sign is referred to the with alternating constriction and dilatation of the pupil with each heartbeat. And Becker's sign is uh, retinal artery pulsations with heartbeat seen on the fundoscopic examination. And in the mouth, there is Muller's sign, M for mouth, Muller's sign. It is ask the patient to open his mouth and look for the uvula pulsations. And moving to the neck, Corrigan's sign is there in the carotids. It is prominent and bounding carotid artery pulsations. It is also described as dancing carotids. Remember this sign, carotid sign in the carotids, Corrigan's sign. And moving down to the abdomen, in the liver and spleen, there are two signs, Rosenbach and Gerhard. Rosenbach's sign is systolic pulsations in the liver, and Gerhard's sign is systolic pulsations in the spleen. And moving to the hand, there are two signs again. Quincke's sign is um, capillary pulsations in the nail bed, especially when gentle pressure is applied on the finger. So these are capillary pulsations in the nail bed. And very important sign seen in the radial artery, that is water hammer sign. It is also known as collapsing pulse. It is a high volume pulse. High volume pulse. There is an sharp upstroke and sharp downstroke with ill sustained peak. This called as water hammer pulse. And finally, in the lower limb, there are two signs in the heard over the femoral artery. Those are diuresis and Probis sign. Diuresis is systolic and diastolic murmur heard over the femoral artery when light compression is applied with the bell of the stethoscope. And Probis sign is pistol short murmur. Pistol short murmur heard over the femoral artery. Lincoln sign is pulsations in the popliteal artery. Remember, this is a very famous and important sign. And finally, last sign, Hill's sign. Hill's sign is the lower limb BP is more than the upper limb BP by more than 20 mm of Hg. Lower limb BP is more than the upper limb BP by more than 20 mm of Hg. This is called as Hill's sign. It is the surest sign in aortic regurgitation. So, these are all the peripheral signs of aortic regurgitation due to wide pulse pressure. And these are mainly seen in chronic aortic regurgitation, but these are not seen in acute aortic regurgitation because uh, in acute aortic regurgitation, left ventricle does not have enough time to adapt. It will lead to the left ventricular failure, acute heart failure. So these are signs are not seen in acute aortic regurgitation. These are signs only seen in chronic aortic regurgitation. And in a nutshell, I have summarized all the definitions of peripheral signs of aortic regurgitation here. I'll take a screenshot and revise all these definitions and signs, and I have also included images to make them easier to understand. So in this image we will see there are alternating constriction and dilatation of the pupil, which is called as Landolfi's sign in the eye. And in this image there are retinal artery pulsations with heartbeat seen on fundoscopic examination. This is called as Becker's sign. And here we can see the prominent bounding carotid pulsations, also referred to as dancing carotids. It is called as Corrigan's sign, right? And this is Muller's sign. Muller's sign asks the patient to open his mouth and look for the uvula. This is uvula pulsation. Look for the uvula pulsations. And here, capillary pulsations in the nail bed, especially when gentle pressure is applied. This is called as Quincke's sign. So that's all about peripheral signs. Thank you for watching.